Assalamu alaikum. Good afternoon. I think it's time to start this session. Welcome to our 27th monthly session of MedEd webinar series. We have now members from 25 countries, and number approaching 2,500. Right. As you know, our topic today is structured essay questions and their marking schemes. But before that, let me share the results of the survey which we conducted in relation to this webinar. First, we got 450 respondents from 22 countries, and this is the list of the countries we got respond. The names are written in alphabetical order, and these are the academic positions of the respondents. Professors, more than 32%, associate professor 21%, assistant professor 20%, senior lecturer 10%, and lecturers 7.3%. So we got a good response from the academics. Thank you for responding. So the first question was, does your institution use essay questions in summative or professional examinations? And more than 86%, that's a huge number. Still the medical schools using essay questions in their assessment of students. And if the answer to above question is yes, which of the following types of essay questions are used? And we see here short answer questions, short essay questions, then is the structured essay questions, modified essay questions, patient management problem. Now we have to be careful a bit about data on this page because we do not have a standard definitions of different types of essay questions. So this answer is based on the understanding of the respondent about the definition of essay, different types of essay questions. Now, there has been a long-standing debate about the essay questions, more against and less in favor. There are a number of papers which do not recommend use of essay questions. However, as we see even in this survey, many medical schools, or most of the medical schools, at least those who responded, are still using essay questions as a method of assessment in undergraduate medical programs. Therefore, the aim of this webinar is to help improve the quality of essay questions. So the learning outcomes of this webinar: after attending this webinar, the participants will be able to explain different types of essay questions, explain the rationale for using structured essay questions, discuss the advantages and disadvantages of essay questions, create effective essay tests that will accurately assess their students' achievements and mark the essay questions more objectively. Let's look at the definition of essay question. This is an old definition and may not exactly apply to essay questions in medical education. However, it gives some important features of essay questions. A test item which requires a response composed by the examinee, usually in the form of one or more sentences. of a nature that no single response or pattern of responses can be listed as correct. So this part may not apply to essay questions in medical education, and the accuracy and quality of which can be judged subjectively only by one skilled or informed in the subject. So this definition was given, let's say, more than 50 years ago. If we sort of separate the different items in this definition, so the first one is that essay question requires examinee to compose rather than select their responses. Elicit responses that must consist of one or more sentences. No single response or response pattern is correct. So this basically definition relates to opinions, discussions, debate, pros and cons, for example, ethical issues. And as I said earlier, this may not apply to essay questions in medical education. The accuracy and quality of students' response to essay must be judged subjectively by a competent specialist in the subject. And this subjectivity is also now an issue and being addressed. Some other definitions. Essay question itself consists of a statement, often several sentences long, that describes a situation and or poses a problem. And students' task is to write an essay to answer the problem posed. So question itself is a statement, and of course, answer also consists of a statement, and the answer may be as short as a paragraph or may cover several pages. Question requiring the candidate to generate an answer rather than select. Such questions effectively shift the focus of assessment from knowledge of isolated facts to the use of basic science principles to solve problems. So these are different definitions highlighting different components or different aspects of essay questions. Broadly, there are two types of essay questions. First, extended response or open-ended, the classical essay questions, which most of us have been using during our medical school days. A restricted response or modified essay questions. The extended response or classical essay questions give greater freedom of response. They are open-ended, involve a number of learning outcomes. They are broad in nature, however, difficult to relate the question to the intended outcomes and to indicate the nature of the desired answer. For example, evaluate the effects of food shortage on the stability of the political system. Now, if you look at this question, there are a number of aspects would come to the student to answer that question. Evaluate the effect of food shortage on the stability of the political systems. What culture are we talking about? Which nation are we talking about? How long is going to be an answer? A paragraph, a page, even a book can be written on this topic. Are the examiner asking for opinions or historical facts? So there are a number of ambiguities in this type of questions, and therefore it is difficult to relate the question to the intended outcomes. On the other hand, restricted response or modified questions are highly structured. They are focused, relate easily to a specific learning outcome. Intent of question can be communicated clearly and can be marked easily. The restricted response essay questions have different types within itself. They can be short essay questions or SEQ, modified essay questions, MEQ, patient management problems. In practice, MEQ and patient management problems are more or less the same structure. Now, the question is that are the short answer questions a type of essay questions as compared to short essay questions? If you look at the short answer questions, they actually do not fulfill the definition of essay questions. Here is an example. Abu, a 14-month-old boy, was admitted to the pediatric wards of Slyang Hospital with the complaints of diarrhea and vomiting of 3 days duration. On examination, he was drowsy and irritable. His skin turgor was poor, eyes were sunken, anterior fontanelle was depressed, and mucous membranes were dry. His pulse was 130 beats per minute, weak but regular. Respiration was deep with a rate of 50 breaths per minute, and capillary refill time was 4 seconds. So the scenario itself gives quite detail of the case. And the question is estimate the degree of dehydration in this patient, and answer would be just 2 words, severe dehydration. So this is an example of a short answer question where the question itself or the scenario of the question is quite detailed, but answer is just 1 or 2 words. That is classical example of short answer question. But if the same question, we want to make a short essay question, then we can elaborate the question saying, estimate the degree of dehydration in this patient and justify your answer by giving reasons based on the findings provided in the case. So I think these 2 examples clearly differentiate between short answer question where answer is just 1 or 2 words, whereas short essay questions, we need to write a few sentences to a paragraph, and that is the definition or compulsory component of an essay question. Here is another example, and the process of the steps through which a classical question or extended response question can be converted into a restricted response question. Discuss various methods to increase the production of food in Malaysia. Second stage, describe various methods to increase the production of rice in Malaysia. So here food has been specified as a rice. And then the restricted response question would become list 5 methods to increase the production of rice in Malaysia. Describe each method in a paragraph. So you can see the difference, all the ambiguities which are seen in the extended response question are clarified in the restricted response questions. If the student gets all the directions, they have to write 5 methods. They have to talk about rice, and each method they have to describe in a paragraph. So that is a classical example of restricted response essay question. Here is another example. Dengue fever is very common illness in the state of Selangor. There is a plan to release genetically modified mosquitoes in Pulau Kitong, which is an island, to study the methods of controlling the dengue spreading mosquitoes. The question, describe in a paragraph, what do you understand about the term genetically modified mosquito? If you look at this question, we are not asking for a definition. we are asking for a comprehension or understanding. So student has to describe in his or her own words rather than simply copying the definition. Second, briefly state how the release of these mosquitoes is likely to help in controlling the spread of dengue fever in Tlokitam or PK Island. Now, again, this question is restricted to a certain area. If we do not mention this, then it can be very general question, briefly state how the release of genetically modified mosquito is likely to help in controlling the spread of dengue fever. So the location has restricted the response. Similarly, the third question, describe briefly how the release of genetically modified mosquitoes may affect the environment in PK Island. Again, there is a restricted to a certain situation. So essay questions have certain strengths. They are effective way to measure higher levels of cognitive thinking. For example, analysis, evaluation, synthesis, if you want to use the Bloom's taxonomy. Students are required to explain complex ideas and identify relationships rather than just list the memorized facts. Essay questions present a more realistic task for the students by organizing and communicating their thoughts. And essay questions are less time consuming to construct as compared to objective type of questions like multiple choice questions. Essay questions enable the teachers to judge students' abilities. For example, to organize, to integrate, to comprehend and interpret materials and express themselves in their own words. Essay questions can also be used to test the writing skills if that is one of the learning outcomes. However, there are weaknesses as well. Essay questions cover less content because of the time constraint. We know that we have 2 to 3 hours and we can ask only limited number of essay questions, whereas the objective type of questions or multiple choice questions, we can have a huge number. Essay questions require more time to mark because the marking would be manual, whereas in multiple choice questions, the marking is done by the computer. While regarding essay question, personal biases can affect the grades assigned, and this is a big issue, and we will be talking about it, how to reduce the biases or personal biases in marking the essay questions. Sampling which topic to select for essay questions. So blueprinting can address this concern. And the reliability, because the sample size is small, so reliability may be compromised. However, this aspect has been dealt in a number of ways, involving multiple examiners in assessing this form of exam, and then using, for example, this is a year 5 where you have 5 or 6 posting, and if you are using essay question at the end of posting examination, so by the time the students are appearing in their professional examination, they have already 6 or 7 examinations based on essay questions. And if marks of those essay questions are being used as a continuous assessment, then the sample may not be small, and that can increase the reliability of this method of assessment. Now, coming to constructing good essay questions, preliminary preparation. Match objectives of the test. So we can use Bloom's taxonomy and what level of knowledge or objective we want to test. If we want to test simply recall, then multiple choice questions are probably the best option. For comprehension and application of knowledge, both single best answer questions and essay questions can be used. However, when it comes to the higher level of analysis, evaluation, or synthesis, essay question is the most suitable choice to assess this level of assessment. The process can be list the content or areas to be tested in the examination and then identify the content that can be best tested by using essay questions. We know that not everything would be appropriate to test in essay questions, so we can look at the areas we want to assess in the examination and choose the one which can be best assessed by using essay questions. It can be put in another way, or the reverse way. First, plan what content is to be tested in the examination. Then identify the content that can be best tested by using essay questions. And then identify the objectives of the essay questions being used. Although this approach is relatively easier, but it's the preferably we should use the first option, that is means that we identify the objectives or outcomes to be tested first and then identify the essay questions. Before we begin to create essay questions, let's ask ourselves some crucial questions. Number one, what kind of information do we want in the answer? Do we want to inquire for facts, or do we want inferences and applications? Most students truly want to provide the answer that the examiner desires and will do so if we ask carefully worded questions. If we look at this statement of obviously, if we want to test only the facts, then essay question would not be the appropriate method. But if we want to assess the inferences and applications, then essay questions would be most appropriate. However, condition is that our questions should be carefully worded so that students can answer the way we want them to answer. Now, this is a very important statement here. Clearly defining the content and purpose of an essay question is important. Content and purpose to make decision regarding test construction, item formats, and other key steps to ensure that the resulting scores provide meaningful information. That is the whole purpose of an examination, to get meaningful information. If the answers or the exam method is not providing meaningful information, then that type of method of assessment is of no use. What could be the objectives of asking essay type questions? Here are some examples. Critical appraisal, relevance or correctness of a concept, idea or information, identification of problems, giving a scenario and then identifying the list of problems, reorganization of facts, discrimination between objects, concepts, or events, evaluation and or synthesis, inferential thinking, pros and cons, and comparing two approaches or methods. If our objectives are like the stated here are similar to them, then probably the essay questions are best method of assessment. Next, Rules of constructing essay questions. Number one, use essay questions to measure complex learning outcomes only. Avoid asking essay questions that require factual knowledge. Factual knowledge can be measured through other test formats such as multiple choice questions, which are more appropriate and cost effective. Second, relate the questions directly to the learning outcome being measured. Clearly stated questions not only make essay question easier for students to answer, but also make them easier for instructors to mark. Use the right verbs. For example, what is the value of studying science fiction? Elaborate your answer by using 3 examples. If we do not add the second sentence, then the question becomes very, very vague. Another example, describe 4 advantages of multiple choice questions over essay questions. So questions are directly related to the outcomes which we want to assess. Third, formulate the question so that the task is clearly defined for the students, which is usually a problem in extended response questions. So indicate the scope and direction of answer required. For example, give 3 reasons for, or discuss the steps how you will. So using the right phrases, right verbs can clearly define the task the student is supposed to deal with. Do not permit a choice of questions unless the learning outcome requires it. So this is another important aspect, and we have been practiced so long that our exam paper might have 6 questions and students are required to 4 out of those questions. It is recommended to avoid giving students the option to answer a select number of questions from an entire list. Reason, this makes the test different, and in order for testing to be fair, the students must perform the same task. And this also compromises the reliability. So all the questions in the paper must be compulsory and no choice for students to select the questions which they want to answer. Use relatively large number of short or restricted response rather than few long extended response essay questions, because in this way we can test more content, we can be more specific, the scoring would be easy. However, the downside would be that less assessment of abilities to integrate, organize, or explain. Number 6, assign marks for correct response. Indicate how many marks are assigned for each correct response, because the student may have to choose what questions to answer when the time is running out. So for this purpose, we must develop a scoring key before administering the test, and also identify the answers which would not carry any marks. That helps the examiner to mark the question. As we were talking about the subjectivity in marking of essay questions, and with these kind of steps, we can overcome the subjectivity and make it more objective. Here is an example. So there's a long scenario, and then the second question is list 2 differential diagnoses for Michael's illness. Justify your answer by identifying 2 clinical features in the case. So acceptable answers based on the scenario is meningitis, encephalitis, or cerebral malaria. And at the same time, the note is given that the brain abscess, space occupying lesion, or febrile fits would not be given any score. So not only we identify the right answer and the specified marks, we also must mention the answers which are not acceptable and for which no score would be given. Provide ample time. Of course, the students need to think, they need to organize, they need to integrate. It's not simply recall. So therefore, an estimated time should be suggested so that students know how much time they can spend on that question. Otherwise, they might miss other components of that examination paper. Now, question, is there any harm in giving some extra time? The usual statement at the end of the time, stop writing, hand over the paper immediately. Is it really necessary? In our opinion, giving few minutes extra does not matter because these are essay type of questions, and some students may be a bit slow in writing, and giving some extra time would not really cause any problem. Use essay questions to measure knowledge. Use essay questions to measure knowledge and reasoning ability, not opinions or attitudes. This is the difference from the original definition, which we saw on the first slide, because in medical education, we are not really testing on opinions or attitudes. We are assessing the knowledge about different situations. Essay questions may have more than one correct answer. So formulate questions to get those correct answers. It is important that our questions are able to get the type of answers which we want our students to provide. And we will have a little bit more discussion on this, how to go about it. Improve the essay question through preview and review. Another important aspect, preview means that you write a model answer, predict student responses, and ask a colleague to critically review the question, the model answer, and the intended learning outcome can reveal. Looking at the model answer, you can judge whether the question is appropriate to get that answer from the students. And the review after is the look at the students' responses to the questions, and you might find that some of the students are giving a kind of response which is acceptable, but that was not included in our original list. So we may have to modify our model answer accordingly. So these are two important methods to improve the essay questions. The next area we want to look at is the checklist for essay questions. Number one, could the item be better assessed with a different kind of assessment? If answer is yes, then that item should not be assessed by using essay question. Is the essay question aligned with the intended learning outcome? Is the essay question too long, and should it rather be split into several relatively short essay questions so that can improve the objectivity and reliability of breaking a too long essay question into small components? Is the question worded and structured in such a way that it will be clear to the students what they are expected to do? The model answer of the question would guide us to make or use the right words for the question and right structure for the question. So if we write the model answer and then look at the question again, that would be very helpful. Is the task presented to students reasonable for their level? Is it not too difficult or too easy? Is there a problem situation included in the essay question? Is it a novel situation? We should not be talking about the situation in the scenarios which we commonly use as examples, but we should create a slightly different situation based on the same principles. Do the students know the recommended time for completing their answers? As I mentioned earlier, we must give an estimated time. Do the students know how many marks the essay is worth? And that would again help the students to choose the right questions if they are running short of time. Have you avoided the use of optional questions? Have you written a model answer or an outline of major points that should be included in the answer? I think this is one of the most important aspects of constructing essay questions, preparing the model answer at the same time. Do you have a person knowledgeable in the subject critically review? That's the preview which we were just talking about. So this is another checklist that whether we have gone through the process of preview for that question. All right, the next aspect of essay question is how to score essay questions. As I mentioned earlier, the subjectivity of marking or bias in marking is a major problem in essay questions. And there are a number of methods which we can use to avoid that subjectivity. One of the major limitations, as I have mentioned repeatedly, the subjectivity of the scoring. The feelings of the scorers are likely to enter into the judgment, and they make concerning the quality of the answer. So the feelings of the scorers should not affect the marking scheme. How do we do that? Scorers should not penalize or reward an examiner repeatedly for the same or one piece of knowledge or mistake. So if students have made one mistake and that mistake is being repeatedly made, so students should not be penalized for that. I'll give you an example here. This is the problem, what we call is the dependent questions. For example, we have given a scenario, and then we are asking the most likely diagnosis. And the subsequent question is that about the confirmatory investigations for the stated diagnosis. Now, this last part, which is the confirmatory investigation for selected diagnosis, depends upon what the diagnosis student has made. And if student has made a wrong diagnosis, but the confirmatory investigations are right for that wrong diagnosis, so what are we going to do about such situations? So we need to have a policy about the dependent questions. And if student has made one mistake, we should not be penalizing him or her repeatedly for the same mistake. It is helpful to create both the model answer and scoring rubrics while composing the question to ensure that the question truly asks for what is stated in the model answer, and number two, to check for higher levels of Bloom's taxonomy. So these two aspects of creating a model answer and creating a scoring rubric would be very, very useful to handle the subjectivity, which is stated to be a big problem in essay questions. So by creating model answer and scoring rubrics, we handle these problems the question truly asks for what is stated in the model answer. So by looking at the model answer, we can judge the question itself and to check for higher levels of Bloom's taxonomy. I'll give some example in a short while about the rubrics. There may be a personal bias towards the writer of the essay or the student, towards certain areas of content or style of writing, or towards shortcoming in extraneous areas such as legibility, spelling, and grammar. We all know, if we have been marking these essay questions, for example, the legibility can be a big problem and might be irritating for the scorer, and that would lead to the penalizing the students for that. These biases distort the results of a measure of achievement and tend to lower the reliability. How to handle such situations? The answer is develop rubrics to promote reliability in grading. Rubrics serve multiple purposes for both students and educators in the learning and assessment process. This is an important aspect in which the rubrics can help both the students and the assessors. Studies on rated reliability have demonstrated that well-constructed rubrics can lead to a common interpretation of student performance, which is critical when administrating a restricted response essay exam. This is really a crucial component, that if we have a good or well-constructed rubrics that can handle a number of issues related to marking the essay type of questions, both from the student point of view as well as from examiner point of view. The rubric should be written when the question is written at the same time when the model answer is written. The rubric should be prepared at the same time. Rubric should contain the elements or objectives that students should address in their responses, and a scoring system reflective of the elements addressed in the question. And this can also handle or point out the marks for different categories and the situations where no mark should be given. The point value for each question should be established to categorize responses as no credit, partial credit, or full credit. Prior to grading, faculty should establish guidelines on how to apply the rubrics to generate a score. While considering the elements that must be included to score partial or full credit, faculty should consider and determine methods for consistently managing how scores will be affected by the following situations. So here I'm going to mention few situations which might arise while we are scoring the essay questions, and how the rubrics should handle that. First, what if student answered the question fully but added extraneous or unnecessary information? So how we are going to handle that? Number two, what if the student used unprofessional language? Are we going to penalize the student for that? Is the student required to both demonstrate, recall, and apply knowledge for full credit? Or points deducted for insufficient English language proficiency, grammar, or spelling? We need to answer all these questions before we start marking essay questions. So the degree of variability in the answers, the rubrics can be handle that and can be modified accordingly. The major task in scoring essay question is to maintain consistency, and that's where the rubrics would come into play. Now, the first statement which I make here is that before scoring, graduates should review, the grader should review 10 to 15% of the responses to calibrate the degree of variability of answer. This is a good practice. We have been doing that because by going through first, let's say about 10% of the answers, we might find some answers which are acceptable given by the students, but were not included in our original list of acceptable answers. So based on that, we can modify our rubrics. So to address the degree of variability of answers. So this is a review and is very useful and makes the assessment or scoring fair, that we include all acceptable answers, which somehow we might have forgotten to include in the list in the beginning. The second essay question can be scored in two ways. One is the holistic method and other is the analytic method. The holistic method involves considering the student's answer as a whole and judging the total quality of answer in comparison to other students' responses are based on certain criteria that has been developed. So this is more appropriate for extended response type of essay questions, where the marks are given on about the answer as a whole paragraph or whole page of and based on criteria as well as comparing with other students, which is very different than the restricted response questions where we use the analytic method. And in analytic method, the examiner prepares a model answer and in which the major components are defined and marks are assigned. So there is a clear-cut marking scheme, and that is can be applied only in restricted response of questions. The students' answers are compared with the model answer, like identification of keywords or phrases. Here are some examples of rubrics as they play a very important role in scoring the essay type of questions. This is an example about explanation or information given or negotiation. So the titles can be in percentage of marks or in distinction, good, pass, or borderline, fail, or clearly fail. And we can have the criteria for each category. So, for example, in distinction part, all important clinical information is correctly provided. Number 2, demonstrates in-depth understanding of the topic. And number 3, acknowledges clinical uncertainties where appropriate. And then as we go down the different categories, and based on the identified criteria, we can place the students whether good, pass, or borderline. Here is another example, quite in detail, about the rubrics and the marking schemes. This is an example of holistic rubric, which, as I mentioned earlier, is more useful for extended response of essay questions. And this is analytic rubric example, which is more appropriate for restricted response essay questions. The rubrics are really so important in marking these essay type of questions objectively that it cannot be really overemphasized. Rules of scoring essay questions. Number 1, evaluate answer in terms of learning outcomes being measured. The Look for the evidence concerning the extent to which clearly defined learning outcomes have been achieved. And this extent can be seen in the rubrics at the different level. However, to apply this, we must make sure that the outcomes have been clearly defined. The desired student performance specified in these outcomes should serve as a guide, both for constructing the question and for evaluating the answers. So obviously the outcomes would help in both, but more importantly, in terms of identifying the components of rubrics. Grade restricted response answers by analytic or point method using a model answer as a guide. As I have mentioned earlier, the analytic method or point method using a model answer and giving marks for different components within the answer is most appropriate for restricted response answers. Marks must be assigned based on the relevance and importance in relation to learning outcomes to be measured, the relevance and importance. Here is an example. This is, for example, part of a modified essay question. We are continuing with the scenario, and the question is that list 5 initial investigations you would request at this stage to help you arrive at a diagnosis, and give one reason for asking each investigation. If you see, the question is very, very clear, telling the students what is expected, and then they're giving the marks for investigation and for reason. So this gives a clear guideline to the students and all the information required for students to answer that, and very, very helpful for the examiner to mark this type of question. Now, grade extended response answers by holistic or rating method using defined criteria as a guide. The model answers, which I have just given an example, may not be possible to write for extended response question or answers. So we need to grade each answer by judging its quality in terms of a previously determined set of criteria or rubrics. So rubrics can be more useful in holistic as a holistic method or for extended response answers, whereas the restricted response, the model answer can be more useful. Here is an example. If students were asked to describe a complete plan for preparing an achievement test, the criteria for scoring will include such things as, number 1, the completeness of the plan. As the question requires to describe a complete plan, so we need to see the completeness of the plan as one of the criteria, and that should include, for example, statement of objectives, a set of specifications, and appropriate types of items. Number 2, the clarity and accuracy with which each step was described. 3, the adequacy of justification for each step. And 4, degree to which various parts of plan were properly integrated. So all these 4 points would be helpful to make a rubric for this kind of question, so that the markings or scoring can be objective for this extended response type of question. 4, evaluate all the students' answer to one question before proceeding to the next question. This is again a very useful tip, that marking question by question rather than paper by paper. For example, if a question paper have 4 questions, So essay type of questions. So it would be appropriate to mark the one question first in all the papers, and then go for second question and mark all the papers and third and fourth, rather than marking all the questions are marking student by student or paper by paper. So marking question by question is recommended because each answer is more apt to be judged on its own merits when it is read and compared with other answers to the same questions. So in this way, we are comparing the answers of the student from all the students answering the same question. Whereas if we go paper by paper, so the marking can be biased. If student has achieved a poor rating in question 1, the examiner might develop some kind of bias, and the same negativity can influence the marking of the subsequent questions. So marking question by question rather than paper by paper or student by student is more helpful to maintain the objectivity and to control the subjectivity in marking the essay type of questions. Evaluate answers to essay questions without knowing the identity of the writer. Of course, this is obvious to control the personal bias. Whenever possible, have 2 or more persons grade each answer. We actually practice this, and this is to improve the reliability. If there are not enough examiners and if there are too many papers, it may not be possible for that all the papers or all the questions should be marked by 2 examiners. Then we can randomly select some questions and mark and see if there is any gross difference. So separate scorers for each question, and it is good that the examiners arrive at a consensus. But if consensus is not possible, and the third examiner may be invited, or if the difference is not significant, mostly less than 20%, then the scores can be averaged. Try to grade all the answers to one particular question without interruption, and this is to maintain the consistency. However, it may not be possible if you have too many papers to mark. Decide how to handle extraneous factors such as handwriting, neatness, spellings. Is advised that the student should be informed about the policy of the institution about handling such factors. In some cases, separate scores may be given for spelling or writing ability. However, this score should not contaminate the intended learning outcomes. Now, should student be allowed to type the answer rather than handwriting? Then the questions about the speed of typing and spelling check or grammar check would come in, and again, it has to be decided by the institution whether it's allowed or not. Decide how to treat irrelevant or inaccurate information. Be on alert for bluffing. Decide how to treat irrelevant or inaccurate information contained in the student's answer, especially if the answer is potentially harmful. If student has written an answer and if that is practiced, that might be potentially harmful to the patient. So what are we going to do about such situation? Are we going to penalize the students? One is for wrong answer and other is for potentially harmful suggestions. if student has given more answers than required, for example, you are asking about the 5 options and students have given 10, so how you are going to mark that? In our practice, we usually accept only the first 5, whether right or wrong, and we do not consider any more than that. Decide minimum score for each answer and write comments on students' answers, especially if the student is failing or is being given distinction, then the marks need to be justified. So how to evaluate the utility of essay questions? There are 5 components which are used to assess the usefulness of essay questions. Acceptability of the method, whether that is acceptable to all stakeholders. Second, educational impact, whether this kind of assessment is for learning and how this assessment is going to impact the learning of the students. Of course, the cost, the validity, and reliability. Again, same things are used as principles of assessment, and the assessment for learning would include communication, collaboration, interprofessional education, critical thinking, and creativity. Now, these creativity, critical thinking are important components for essay questions. To assess the validity, here is just an example. Let's say the learning outcome says that students will be able to set an intravenous line in a mannequin in a clinical skill lab. So we know obviously the valid test would be to give that opportunity to assess the students in clinical skill lab. But if the learning outcome says that students will be able to set an intravenous line in a patient, how we are going to do that? Is it possible to do it in exam? I think that was the last slide. Thank you for your attention, and I'll be happy to answer any questions you might have. Right. Any questions? Yes, Professor Muhammad Aslam.
Thank you very much, sir. Thank you very much for such a meaningful, purposeful, and useful presentation.
Thank you, sir.
Yes, and my one remedy is that marking question by question and not by paper and paper. Some of the universities and medical schools have advised to distribute, for the students to give separate sheet for each answer. So question number 1 is to be written on sheet number 1, and question number 2 is to be written on sheet number 2, so that that fact could be restricted or avoided possibly.
Yeah, I think that's beautiful. That's a very good approach.
Yes.
Because really marking question by question makes a big difference rather than marking paper by paper. Yes.
But one handicap in this is unnecessary use of paper, and more copies have to be made. That is one. I'm not sure about my question is about the dependent questions.
Right.
If the diagnosis is wrong, right, then the relevant investigations and further dependent answers will also be wrong. I'm still confused to give him 0 if the diagnosis is wrong for all the possibilities, or to give the punishment as proportionate. I don't know.
All right. I think that's not just your problem, sir. It's everybody's problem, and there's a lot of debate and confusion about it. Important thing is that we have to decide in advance. That has to be the part of the policy. Now, one point is that if question is that give the let's say, 2 confirmatory investigations for the diagnosis you have made. Now, student has made the diagnosis and they are giving the right investigation for that diagnosis. So, and again, let's say if the student has given the wrong diagnosis, then we would be penalizing the student for one mistake for multiple times. So I think this is an important decision which need to be made at the institution level. We have different situations. Some people advocate that if the investigations are right for the stated diagnosis, maybe we can give half marks rather than full marks. But again, obviously it depends. Otherwise, and these dependent questions which may appear in modified essay questions or even in OSCEs. If student gives wrong answer to the first question, then they may lose the
Yes.
For example, if you have an instrument and you ask the student to identify the instrument and students has identified wrongly, then they lose marks for the whole question. So this is an important debate which we need to look into. Right, Dr. Aisha Abdullah.
Yes, Assalamu alaikum, sir.
Walaikum
I hope
assalam.
you're fine. After a very long time, I'm able to join your session.
Yeah.
As you know, I wasn't.
Welcome. That is, I'm glad you are able to join now.
Yes, sir. I'm still on oxygen, but still, alhamdulillah, I can at least attend the session. Right. So my question, rather a comment related to what Professor Aslam just highlighted is, with regard to questions in which the students are giving a wrong answer and then subsequently right answers with regard to the answer that they have given. Right. The basic utility of these questions, the constructive response questions, is in their ability to test the underlying cognitive processes. Right. And if our rubric does not have, it does not account marks and does not allocate marks to the underlying cognitive process, then we would end up with these problems. That's if right. The cognitive process of analytical thinking, logical thinking, and putting things into a logical framework is there, and as an indicator, marks are allocated to it, there would be no problem in marking such questions like this one.
I think Dr. Aisha has brought up a very, very important aspect. As we said, the major purpose of essay type question is assessing the critical thinking and the problem solving situation. So if we make rubrics which actually accommodate these important aspects of assessment, then we can deal to a great extent with these dependent questions. I think that's very, very important suggestion and very, very important aspect Dr. Aisha has mentioned. Thank you for that. Dr. Sunil.
Good afternoon, Prof. Malik and everyone. Thank you. Thank you for that good talk. Just sharing a few thoughts. I mean, I don't have any questions as such. Because ours is an integrated curriculum, we use a structured essay question which integrates across disciplines, right? We generally allot about 10 minutes because students need to go through the scenario and also think before they put down the answer. And so that's one thing we do. The second thing is because our number of students are quite big and we have a lot of markers required, so we don't practice double marking, but at the same time we ensure quality assurance because our professional exams are always chaired by external examiners, so they look at the consistency in marking by examiners. So that's another way of going about ensuring quality assurance.
Okay.
The third thing we do is because in our preclinical years we know the students are still, I mean, they really haven't been to the hospitals so much that they can actually make a diagnosis on their own. Though we train them, we make them think, but I think the emphasis is more on making differential diagnosis rather than making a diagnosis. So as I was mentioning, that we tend to avoid giving questions which include diagnosis and then subsequent investigations, and maybe even talk about principles of management. So I think it depends on your context. I agree that
actually we would go for more for pathophysiology
that's right
aspects in that level, which would obviously assess the students understanding about the situation. Yes,
that's right. So even when we test pharmacology, we don't ask them to give the names of drugs, the dosage and things. We rather look at whether they can know why that drug was used, what is its mechanism of action, or if there are any specific side effects which are relevant to that particular scenario.
All right. Thank you for sharing. Thank you for sharing, Dr. Sunil.
Thank you so much.
Dr. Laikuzaman, please.
Assalamu alaikum, sir.
Walaikum assalam.
And everyone, I had two questions and a comment to make.
Okay.
Since this is about understanding and not just recalling knowledge, do the writing skills have to be one of the program outcomes or objectives of any particular session for them to be incorporated, through the short essay questions? You think that is one? Second, I feel that standard setting for each essay question would be very, very needed, probably essential, whichever method we use, and go borderline, whatever. But I feel it would be very much necessary. And third, if I may share, we at our university are moving from select type questions to supply type questions. So we thought that it may be best to start with short answer questions, moving from multiple choice questions to short answers questions rather than short essay questions or even structured essay questions. Your thought on that would be needed. Thank you.
Let's answer your second question first. The short answer questions, of course, they assess the ability to analyze, our ability to interpret. But I think by definition, they cannot be called essay type of question. And the other important point, which I may not be 100% right, the short answer can be whispered to the student. So the opportunity for teaching may be more easily available in that. For example, the scenario I given and the answer is only the severe dehydration. So that may not be really students' own answer. But if we ask them to give reasons for that answer, so that would be thinking process going on. Second, the chances of, let's say, by chance, the answer by chance would be high if we are using short answer questions, because again, we know in that situation only 3 possibilities is mild, moderate, or severe dehydration. So student might just guess. So those are my reservations about short answer questions, although their usefulness is there. Your second part about, I think we need to have some kind of training for writing skills, maybe a part of personal and professional development, because one of the things which we expect from our graduates later on, that they would be doing some research and they have to do some write-ups, etc. So that's my personal thought, and that might be useful if it can be accommodated. But we all know that the limitation of time is a big issue in medical schools. I hope I answered your questions. Yes.
If you could quickly ask now, I was asking if the writing skills should be a part of the outcomes or the objectives. I think that should be there to be able to justify an assessment of writing skills. That was my question.
I'm not sure about that. Of course, we need the students their ability to able to justify, but whether they are able to use a good language for that and how much they can do, I'm not really sure about that. Maybe some other members can share their thoughts on this.
Thank you very much.
Right.
Thank you.
Reham, Dr. Reham, please.
Good morning, Professor. Thank you very much for the presentation. Can you hear me?
Yeah, sure. Yes.
Yeah, right. I actually have two questions. For the dependent answers, I'm thinking it would be better if we avoid the dependent questions altogether. For example, if I'm using like a question about like proteinuria in a pregnant female in third trimester, instead of saying what's the diagnosis, I can ask for list 3 differential diagnoses. So the next question, when I say list the further diagnosis to confirm one of the diagnoses that you chose, so it won't really be a dependent, there won't be this dilemma of should I score him negatively for the 2 questions, or what do you think?
No, you are right in that. Actually, there are a number of ways where we can handle these dependent question, and especially in modified essay question, they can be done relatively easy. But it becomes a problem, for example, in OSCE.
Okay.
Yeah, so your question is about a situation or a diagnosis or a sign or an instrument, and the student the answer to first question is wrong. So because in OSCE the subsequent questions would depend on the first one, so that becomes a problem. But as you said, we can try different methods to avoid that. But at the same time, I think we should have a clear-cut policy at the institutional level how to handle such situations.
Okay, so can I have one more question, please?
Yeah, sure, please.
Sometimes in an exam, like when I say, what's your diagnosis? For example, if I go there and I say, what's your diagnosis for this case? That's a short answer. And then for the next question, I say, list 3 tests to validate or to proceed with your diagnosis. So that's a short answer. So can I really do that in an exam? It's a mix of short answer questions and short essay or restricted essay questions.
Yes, I think if you go through the question I shared, the example of modified essay questions few days ago in the group, that has a mixture of short answer and short essay questions. So in that situation, because your subsequent questions are depending on the first one, so okay. I think they can be used in the mixed format.
Yeah, so I can use both short answer and restricted answer questions in the same exam, in the same exam paper,
yeah,
right?
In the same, yeah.
Okay.
Yeah, right.
Thank you so much.
Thank you.
Thank you.
Right. The next is Himangini. Please, Himangini Shah.
Good afternoon, sir. Thank you for the valuable inputs on this aspect, because it's very important to get clarity since there are so many different views. I have 2 questions. One is, if the students uses diagrams or flowcharts, can that be given additional marks and included in the rubrics? Because it sometimes does help understanding in a better way, and it also saves on their time.
Generally, when we want that, we would write in the question, please, for example, use a flow chart to explain your answer. So we would include that in the question if we want to to have that. But at the same time, if clarity or better explanation is one of the criteria you are using, then of course that would carry additional marks, but that should be included in the rubric before the examination, not after the examination.
Right. The university sometimes puts a general statement as to use diagrams wherever necessary. So this could be made more specific.
I think rather than making a general statement, it would be good to make specific in that particular question. For example, you use the flow chart in that particular, so that would be specific rather than a generic statement.
Okay, the second question, sir, was many universities have restriction of use of colors for the paper. It's not directly related to the content, but use of colors for underlining headings or, you know, highlighting matter in the questions.
Right.
So, any opinion on that?
What's the reason why it's prohibited?
Because maybe it could serve as an identification of the student to the person who marked.
Yeah, I see. Right. Yeah, of course, if that's the reason that these colors can be used as identification, then obviously that should not be allowed, because that's important that the scorer does not know the identity of the students. Yes.
Thank you, sir.
Thanks. Yes, Nadia Shams, Dr. Nadia Shams, please.
Assalamualaikum, sir. I'm from Pakistan. I just want to ask, what's your opinion whether these essay questions should be used for formative assessment or for summative assessment, according to the feasibility and other factors?
Yeah, and they can be used for both summative as well as the formative. In fact, the example I gave, if we are using these essay questions for formative assessment, and that formative assessment is contributing to the summative assessment, that actually strengthens our point, because then we can say that we have enough number of essay type questions to improve the reliability. Then we can, the objection that only one or two essay questions cannot be reliable, but if we have been using these questions continuously on formative basis, that can actually to be used as to improve the reliability. So that so what I'm saying is that we should be using in both formative and summative assessment. Right, Dr. Shobha Jayaram.
So good afternoon, sir. Thank you for the excellent and informative session on this the much needed topic of essay questions. Sir, I have a small comment as well as a question to make regarding this. I feel that the subjectivity is actually the advantage or the beauty of the essay questions. If how far we are justified in making it structural and losing the subjectivity and making it more objective type of a question, instead of like giving it the structure, because we are actually analyzing the students' ability to structure it. And if we ourselves give the structuring part of it, I feel that the students must structure it and write. And like how far we justified to give the structuring pattern to the students. Will it not like rob the beauty of the main questions, because it will make it into 5 objective type of questions rather than the one essay question? That was my
that's very interesting thought. Very interesting thought about this. The problem is that we need to have some kind of fair marking or fair scoring, and we need to, for that purpose, we need to avoid the subjectivity. The answer to that is that if you want to maintain that, then you need to have multiple scorers, multiple examiners. So that is another way of dealing with the issue of subjectivity and the reliability. So if you want to maintain the way you are saying, then you need to have more than one scorers. So because if there are 2 or 3 experts are giving their opinion, that adds to the reliability. So you can
what I was actually suggesting or commenting was the structuring part should be done by the student, and rubric should be awarded for the structuring part of it. Like the descriptive answers, it should be actually a part of the, we should train the students prior for how they have to structure the answers. We should not give it as a part of the question. That was my concern.
Right. That's what I'm saying, that actually it's an interesting point. But the main objection would be the fairness in scoring these students, and that can be handled if we have more than one subject experts looking at those answers, and they coming to a consensus. That would increase the reliability of the marking.
Yeah. Yes, why actually I brought out this was, nowadays, because of the COVID pandemic, as well as most of the students who come to the MBBS, they are all assessed only by MCQs. They have lost the ability to actually plan the answers and analyze the answers and the situations. Most of them are only trained in MCQs. We are really feeling it difficult when they come to the MBBS part of it to actually assess them for this. It will become completely objective, and the actual beauty of it is completely lost. That was my concern.
I really agree with you on that point. Thank you for that. Dr. Imran Pasha.
Yeah, hello sir. I just had a point to make with regard to the colors being used for marking. Since in our university we usually digitally scan the answers, and we have a digital evaluation center. So that is one of the reasons most of the universities are restricting. So I take the point given by ma'am. Also, it can be used as an identification. But in most of the universities, they avoid colors because while scanning, it may not be legible, or may not be readable. So that is one of the reasons putting on the colors being used in the answer papers.
Actually, I haven't come across such problem. That's why I was not really aware of that. Thank you for sharing that. Dr. Aisha Abdullah, please.
Sir, I just want to make 2 comments. Just wanted to highlight the common mistakes that we do in making these questions. One was that I have observed in my experience. One is that the same learning objective is used in MCQs, and the same is used for making a constructed response question, which is rather not required. The content coverage that we want can be achieved through MCQs, and the constructed response question should be used for the cognitive process that we are targeting. And then secondly, the hyperstructuring of the scoring key. When it is hyperstructured, then again we are losing the objective of having the constructed response question. Thirdly, the limitation of using these questions is not because of the student's competency in answering these questions, but it is because of the inability of the examiners to assess those questions fairly. And we need to keep this in mind when we are designing our systems for teachers training, that if the teachers are trained to deal with debatable topics, to deal with ambiguity, and score that ambiguity objectively, then I think then we can find the true utility of the constructed response questions.
Right. Okay, Dr. Aisha, obviously the first thing is that we need to see whether whatever area we are testing, what is the best way of testing that, because essay question may not be useful in every situation. Second is, I think, blueprinting. blueprinting would help us to avoid duplicating the same questions in MCQ and others. The third, which you said, of course, teachers training. Nobody can deny the usefulness of teacher training in marking these questions, if possible, because that may not be easy also for every institution. Thank you. Dr. Ahmad Mishwani, please.
Thank you very much, sir. Assalamu alaikum, everybody, and I must congratulate you for this excellent and very useful and informative presentation, like all of your previous presentations.
Thank you, sir.
Just one question regarding this dependent questions and repetitive or recurrent penalty for the questions. I think that still remains there. But one of the suggestions for that is, as has already been suggested, that because this question, such questions these are for analytical purpose. So the first question, element of the question regarding the diagnosis, we can to some extent address this issue that if we give minimum numbers to the first question of diagnosis, if the student gives a wrong diagnosis, he loses a small bit of numbers. And then the analytical portion of diagnosis or investigations or treatment should be based on the ability of the student to whatever diagnosis he or she has made. If he has correctly analyzed and applied the knowledge, then that should be given. But there is another important aspect also, because some of the smart students may misuse this approach. And as has happened in one of the postgraduate examinations, an examiner asked a question from a student, and the student was not knowing the answer for that particular question. He said that I don't know this thing, but I know this topic. The examiner said, okay, answer this question. And then the whole viva or the question answer continued on that. And because the student was very well prepared for that question, so he got very good marks in that. So that one also must keep in mind.
Yeah,
and
I think that you are right. A smart student or examination smart student can misuse that, and they may give a diagnosis of their choice because they know that the subsequent marks would be based on that. So again, as I said, there is no straightforward answer, and there's a lot of debate. But whatever it is, we must have a clear-cut policy before conducting the exam, not changing that after the exam.
The other, in one of the slides, you have very rightly mentioned that we must have a predetermined policy for the overwriting or the harmful answers. But about 20 years back, in Army Medical College, under the leadership of General Aslam, we attended a workshop on the assessments. And one of the very important points which was raised and highlighted was that there should be no fatal answer or fatal questions. As you have very rightly said, sometimes if a student is very good, but if he makes a small mistake in the first question, gives a wrong or a harmful, or you may label it a fatal answer, then the teacher becomes, or the assessor or the examiner become biased that this has, and most of the time the teachers quote that thing, that look, he has given this answer and it is so fatal. So even if the student is very good and he gives out of 10 answers, one question or one sentence in the answer is fatal, he or she, the student, loses all the marks, and that poor chap is penalized for that. So I think this should also be, as we are practicing in the postgraduate CPS examination, we are supposed to mark each and every question there and then. We are not allowed to wait for the next question before starting the next question or asking the next question. We are bound to mark the first question, because the purpose or objective is that one, the answer of one question should not affect the answer of another question. So
Yeah,
that is also very important, sir.
Yeah, thank you very much, Dr. Ahmed. Again, I would say that we need to have a policy about at the institution level, how to handle this, and everybody should be clear about it. Thank you very much. Dr. Mumtaz,
Thank
please.
you, sir.
Sir, I can't hear you. You need to unmute yourself, please. Dr. Mumtaz, unmute yourself, please.
Okay, I have unmuted myself.
Right. Okay.
Assalamu alaikum.
Wa alaikum assalam.
In a very good webinar on medical education, I must appreciate it. And I have just to make a small remark about the dependent question.
Right.
Even if the diagnosis is wrong, and the student gives a valid reason for the investigation, I think he should be given some marks.
Yes, I mean that's one point of view. But on the other hand, like Dr. Ahmed was saying just now, that a clever student may give a diagnosis for which he or she knows the answer to subsequent questions, so that can be misused. But having said that, there are a number of points in favor and against. Important, as I'm saying again, is that we need to have a policy about that at the institution level and should stick to that.
Yes, exactly.
Thank you. Yeah. Any other questions? Questions? Yeah. Here is can we ask calculations? Yes. In the essay questions, if you give a scenario, of course, we can ask them to, let's say, calculate certain things. For example, the maintenance fluid or hydration fluid, or the common things, of course, can be included in that. I think I don't see any more questions. Thank you very much, everybody, for your kind attention. Before I end, I have 2 more slides to share. One is about the upcoming webinar, which would be on 25th of September, and it would be on student-centered learning at the same time. And the next is my usual appeal to everybody to donate $1 or equivalent amount in your local currency to any deserving individual in your neighborhood or public organization in your community. Thank you very much for that. And we'll see you again, inshallah, in September.
Thank you very much, Professor.